It all started from a traumatizing experience getting tested positive for coronavirus. It was a very overwhelming sight. Going to the hospital and seeing the way they were dressed in like hazmat gear from head to toe, everything covered, and how organized it was in the sense of like, do you have symptoms? Do you have an appointment? Like, here are my symptoms. Okay, follow the blue tape, go to the doctor's office, they're gonna sign you in. Once you get checked in, they're gonna make you follow the red tape, go upstairs and get tested. And it was just like very like demanding and not there was no empathy, compassion, no clearance, no clarifying instruction. It was just very confusing, overwhelming, and it was the worst experience. I had a hard time getting tested for the reasons of having anxiety, telling myself, like, am I even gonna make it? Am I gonna die? Having all these thoughts run through my head because of the negative light posted on coronavirus in the media, through news, social media, through Facebook, Instagram. And so I just had all these negative thoughts running through my head. And as soon as I got into the doctor's office and they told me that they were going to test me to go up and they're going to send me to a room and patient coming and they would clear their way and I would walk through, I felt very alienated. I felt like I didn't belong there and I felt like I was like a disgust. They looked at me like in complete blank stare. Like, I don't know the message I was getting from it, but it wasn't a very positive one. And as doctors and nurses and healthcare employees, they probably see this on a daily basis. But for someone experiencing this brand new and a person who isn't sure if they have symptoms or not, or is having this um, unknown virus affect them, it was very, 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 very scary. I cannot emphasize how scary it was. I It brought me to tears a couple times in the hospital when I was getting tested. One time was the first time when I was talking through the lady to check me in. It was like, it reminded me like a jail conversation. I had to pick up a phone and she would pick up the other phone and we would talk through a glass wall. And I understand that it's very important to take precaution to protect the healthcare workers, which is very, 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 very smart of them to do because we need them. But it was just like, there was no like human relation. There was no communication in a way to like calm me down and tell me I will be okay and that this is like okay, like knowing that this was my first time and sitting there in tears. I expected more. Um, the journey of having COVID was horrifying, from not being able to sleep, from constant coughing, from not being able to taste or smell for a couple of days, from chest pains, losing sleep, being afraid to sleep, counting down my 14-day period, just all of it. Getting phone calls left and right from random numbers that I had no idea. It was as if they like sent my name and tested positive in a generator, and all these numbers had access to my phone number. And it was like Board of Health, this nurse, and this doctor, and this person doing research, and this. And it was just crazy. It was a horrible experience. The reason why I want to bring light to it, and the reason why this is so essential, is because for someone who was a US citizen, for someone who was very, very educated, being a college student, wanting to be a doctor, knowing the medical field, the procedures, different um, medical ethics, it was just knowing a lot. And I was still having a horrible experience and feeling overwhelmed and traumatized and like literally having post traumatic stress from going to hospitals now. It's just absurd. And for someone like me who has all the resources available and is able to communicate my feelings, compare that to someone who can. Compare that to the unfortunate. Compare that to the immigrants who are undocumented and don't have English as their first language and has a language barrier with the healthcare professionals, those who are seeking medical treatment or those who are experiencing treatment. Or, for example, a lot of Chelsea residents are those who have immigration status and live in a household of 8 to 10 in one household, and one person has it and now they all have it. And being known as a Chelsea hotspot and seeing it constantly on the news, and the resources that are getting sent out to us, it's amazing. It seems so positive. We're getting all the help, but in reality, it's traumatizing. It's traumatic. It's like overwhelming. Seeing army trucks pass by your house, it can be overwhelming. It's scary. Like it looks like a war zone. You don't understand from someone's perspective of not being educated, can't understand what the news is saying, don't have access to internet or cable. Um, and seeing these houses, these tanks drive by their houses, it's just, I think there needs to be more done. And seeing Chelsea as a hotspot on the news and knowing that I am a person, a resident of Chelsea who got tested positive for COVID, but is on the fortunate side of healthcare. And I just question, what about those who don't have what I have, who don't have access to the resources I have? What help are they getting? They're worried about getting deported, so they're scared to go to the hospital. They don't want to give their information out. They don't want to give their true identity out because they're afraid that they're gonna get seen as undocumented and we need to report this person. And it's just scary. And there was an article that I read, and her famous quote on that article was talking about those who live in Chelsea and how scary it was. And it was the executive director of the Chelsea Collaborative Program. And she said, I think the fear of immigration status continues to be a big fear in the community because of the person we have in the White House. We're telling the community to please get tested. That's the only way we're going to end this pandemic. Today is not a fear about immigration. Today is about saving lives. And I think that's very important. The priority is about not having the death rates rise, but rather the survival rates rise, and seeing that more portrayed throughout the news and media, passing on this positive message that this virus is not going to kill us. We can kill it if we work together and we use the help of each other and the resources available, and using our advantages of the fortunate to help those who are unfortunate. It's very important to communicate here and have resources available for everybody, whether you can understand English or not, whether you have an immigration status or you're a citizen, whether you have health care or not. Like this, a virus doesn't discriminate, so it's not the time to discriminate now. We need to work together so we can kill this pandemic. Um, I think it's important um, to address this in a way that everyone can be aware that it is okay to go get tested. They're not gonna, don't be afraid. Like, we need you to get tested so we can help stop the spread. Like the Chelsea executive director of Chelsea Collaborative said, um, Gladys Vega, we need to use her advice. We need to get tested. The National Guard is here to help, even though it's a scary sight. They're providing food sources for those who need it. Essential employees that are experiencing symptoms must reach out. We need to have some type of hotline or something that they can reach out to and feel comfortable in every sense of way to make that be known. And hopefully the help gets sent to where the help needs to go. And that's the only way that we'll end up rising up from this global pandemic.